Are you, or perhaps a senior you care for, unknowingly making small, daily choices that could be harming your kidneys? It's a situation many seniors face, and these choices could be silently raising their creatinine levels. But the good news is, we're about to uncover these common mistakes. You see, creatinine levels are a vital indicator of kidney health, especially for seniors. It's surprising, but even seemingly minor daily habits can gradually push creatinine higher. This, in turn, can increase the risk of kidney problems or even signal an underlying disease. Understanding which behaviors contribute to elevated creatinine is key, as it empowers seniors and their caregivers to make informed lifestyle adjustments and support healthier aging. Number 1. Inadequate hydration. Staying well hydrated is, of course, fundamental to our overall health, and it plays an especially critical role in kidney function and maintaining healthy creatinine levels. Our kidneys are truly remarkable filters, tirelessly working to remove waste products and excess fluids from our blood. Creatinine, a waste product that's generated from muscle metabolism, is one such substance that the kidneys efficiently excrete. But, and this is important, for the kidneys to perform this filtering magic effectively, they require an adequate supply of water. You see, when we don't drink enough fluids, the blood volume decreases, and this leads to a reduced flow of blood to the kidneys. What this means is that the kidneys have less fluid to work with, making it harder for them to filter out waste products like creatinine efficiently. It helps to think of it like trying to clean a very muddy filter with just a trickle of water. It's not going to be very effective, is it? Similarly, when we're dehydrated, the concentration of creatinine in the blood can rise simply because there isn't enough water to help flush it out. Now, for seniors, the risk of dehydration can unfortunately be higher due to several factors. Age-related changes can diminish the sense of thirst, meaning you might not feel thirsty even when your body really needs fluids. Also, some medications commonly taken by older adults, such as diuretics, can increase urine output, leading to greater fluid loss. And sometimes, mobility issues or even concerns about frequent urination, especially at night, might inadvertently lead to drinking less. The consequences of chronic, even mild dehydration on kidney health can be quite significant over time. When the kidneys are consistently forced to work harder with less fluid, it can really put a strain on them. This strain can contribute to a gradual decline in kidney function and, in turn, lead to persistently elevated creatinine levels. In fact, elevated creatinine is often one of the first signs that the kidneys are not filtering blood as well as they should. Therefore, ensuring adequate hydration is a truly proactive step seniors can take to support their kidney health and keep creatinine levels in a healthy range. It's not just about quenching thirst, it's about providing your kidneys with the essential resource they need to do their vital job. Making a conscious effort to drink water and other healthy fluids throughout the day is a simple yet powerful habit for maintaining kidney wellness and preventing an unnecessary rise in creatinine. So, aiming for consistent fluid intake is really key. While individual needs can vary based on activity level, climate, and overall health, a general guideline is to sip water regularly throughout the day, rather than waiting until you feel parched. Carrying a water bottle can serve as a helpful visual reminder, and incorporating hydrating foods like fruits and vegetables can also contribute to your daily fluid intake. And of course, if you have any underlying health conditions, especially heart or kidney issues, it's always best to discuss your specific fluid needs with your healthcare provider, as they can offer personalized advice. Number 2, overuse of certain medications. While medications are often essential for managing various health conditions in seniors, it's important to know that the overuse or inappropriate use of certain drugs can inadvertently place a significant burden on the kidneys, potentially leading to increased creatinine levels. Our kidneys, you see, are responsible for filtering out not only bodily wastes, but also the byproducts of many medications. When these organs are overworked or damaged by specific drugs, their ability to excrete creatinine efficiently can be compromised. One major group of culprits includes non-steroidal anti-inflammatory drugs, which you might know as NSAIDs. These include common over-the-counter pain relievers like ibuprofen and naproxen, as well as some prescription medications. While they're effective for pain and inflammation, long-term or high-dose use of NSAIDs can actually reduce blood flow to the kidneys. This can impair their function and cause creatinine to accumulate in the bloodstream. Seniors, who may already have some age-related decline in kidney function, can be particularly susceptible to NSAID-induced kidney damage. Another category of medications to be mindful of includes certain antibiotics. Some antibiotics, particularly aminoglycosides or high doses of others, can be nephrotoxic, which means they have the potential to directly harm kidney cells. Now, these are usually prescribed for serious infections, and their benefits generally outweigh the risks under careful medical supervision, but their impact on kidney function is a critical consideration. Monitoring creatinine levels during and after treatment is often necessary in these cases. Similarly, some medications used to treat high blood pressure, such as ACE inhibitors and ARBs, angiotensin II receptor blockers, while generally kidney protective in the long run, can sometimes cause a temporary increase in creatinine. This might happen especially when starting the medication or if dehydration occurs. This usually normalizes, but it really highlights the importance of regular monitoring by a healthcare professional. Furthermore, the contrast dyes used in certain imaging tests, like CT scans or angiograms, can also pose a risk to kidney health. This is particularly true for individuals with pre-existing kidney issues or those who are dehydrated. These dyes can temporarily affect kidney function and cause a spike in creatinine levels. That's why patients are often advised to hydrate well before and after such procedures to help flush the dye out of their system. It's truly crucial for seniors and their caregivers to maintain open communication with their doctors and pharmacists about all medications being taken. This includes over-the-counter drugs and supplements. Understanding the potential side effects of each medication and ensuring they are used only as prescribed is paramount. Regular medication reviews can help identify any drugs that might be contributing to kidney strain, allowing for adjustments in dosage or perhaps a switch to a safer alternative if necessary. This proactive approach can really help protect kidney function and prevent medication-related elevations in creatinine. The key message here isn't to avoid necessary medications, but rather to use them wisely and always under medical guidance. It's so important to always inform your doctor about all substances you're taking and never adjust dosages or stop a prescribed medication without consulting them first. If you find yourself frequently relying on over-the-counter pain relievers, it's a good idea to discuss safer long-term pain management strategies with your healthcare provider. Your doctor can help weigh the benefits and risks, ensuring your treatment plan supports not only the condition being treated, but also your overall kidney health. Number 3, excessive protein intake. Protein is, without a doubt, an essential nutrient. It's vital for building and repairing tissues, producing enzymes, and supporting our immune function. However, when it comes to kidney health and creatinine levels, particularly for seniors, moderation in protein consumption is really key. You see, the process of metabolizing protein produces waste products, including urea and creatinine. Creatinine, specifically, is a byproduct of creatine phosphate breakdown in our muscle tissue. While a normal amount of protein intake results in a manageable amount of waste for healthy kidneys to filter, an excessive intake can place an undue burden on these important organs. When you consume more protein than your body actually needs for its daily functions and repairs, your kidneys have to work much harder to filter out the increased amount of waste products generated. For seniors, whose kidney function may naturally decline with age or perhaps be affected by other health conditions, this extra workload from high-protein diets can be particularly challenging. If the kidneys are already operating at a reduced capacity, forcing them to process a large protein load can actually accelerate the decline in their filtering ability. This, in turn, can lead to an accumulation of creatinine in the blood as the kidneys struggle to excrete it efficiently. Now, this doesn't mean seniors should drastically cut protein. Adequate protein is crucial for maintaining muscle mass and strength, which is especially important in later years to prevent frailty and falls. The real concern lies with excessive intake, which we often see with certain fad diets or an over-reliance on protein supplements. It's all about finding the right balance. Diets that are extremely high in animal protein, such as red meat, can be particularly taxing on the kidneys over time. While these are complete sources of protein, they also generate more acid load for the body to neutralize, a task in which our kidneys play a part. Consistently high protein consumption can, in some individuals, contribute to hyperfiltration, a state where the kidneys are overworking. This might seem like a good thing initially, but it can lead to damage in the long run. Understanding your individual protein needs is very important. These needs can vary based on factors like your age, body size, activity level, and overall health status, especially your kidney function. Consulting with a doctor or registered dietitian can be incredibly helpful to determine the appropriate amount of protein for your specific situation. They can help you create a balanced eating plan that provides sufficient protein for your needs without overloading your kidneys, thereby helping to maintain healthy creatinine levels and protect your long-term kidney health. Making mindful choices about your protein sources can also be quite beneficial. Including a variety of protein sources, such as lean meats, poultry, fish, eggs, dairy, and wonderful plant-based options like beans, lentils, and tofu, can contribute to a more kidney-friendly diet. Also, spreading your protein intake throughout the day, rather than consuming a very large protein meal all at once, can be gentler on your kidneys. Number 4, poor blood sugar control. For individuals living with diabetes, or even those with prediabetes, maintaining stable blood sugar levels is absolutely paramount. This isn't just for managing the condition itself, but also for protecting vital organs, especially the kidneys. You see, poorly controlled blood sugar, which is characterized by persistently high glucose levels, can lead to a very serious complication known as diabetic nephropathy or diabetic kidney disease. This condition is actually a leading cause of kidney failure, and elevated creatinine levels are often an early warning sign that the kidneys are under duress due to high blood sugar. The mechanism by which high blood sugar damages the kidneys is quite multifaceted. Over time, elevated glucose levels can damage the small blood vessels within the kidneys, the very ones responsible for filtering waste from the blood. These tiny filters, called glomeruli, can become scarred and less efficient. As this damage progresses, the kidney's ability to filter waste products like creatinine diminishes, causing creatinine to build up in the bloodstream. Furthermore, high blood sugar can also cause an increase in pressure within these filtering units, a condition known as hyperfiltration. Initially, the kidneys might seem to be working overtime, but this sustained high pressure eventually wears them out, leading to a decline in function. It's also important to note that poor blood sugar control contributes to high blood pressure, which is another significant risk factor for kidney damage. So, the combination of high glucose and high blood pressure creates a particularly hostile environment for the kidneys, accelerating the progression of kidney disease. Seniors with diabetes really need to be especially vigilant about managing their blood sugar. Regular monitoring of blood glucose levels, adhering strictly to prescribed medications, including insulin if needed, following a diabetes-friendly meal plan, and engaging in regular physical activity are all crucial components of good glycemic control. Even what seem like small improvements in blood sugar management can make a really big difference in slowing down or preventing kidney damage. If creatinine levels start to rise, it's a clear signal that the kidneys are being affected. This should prompt an immediate discussion with a healthcare provider about intensifying efforts to control blood sugar and protect any remaining kidney function. Early detection and intervention are absolutely key here. This often involves regular urine tests to check for protein, which is called albuminuria, and this can be an even earlier sign of kidney damage than elevated creatinine. Blood tests for creatinine are also used to estimate the glomerular filtration rate, or eGFR, which measures how well the kidneys are working. Working closely with a healthcare team, including a primary care physician, an endocrinologist, and a registered dietitian, can provide seniors with the tools and support they need to effectively manage their blood sugar. This proactive approach not only helps in controlling diabetes, but also plays a vital role in preserving kidney health and preventing creatinine levels from creeping up due to preventable kidney damage. Number 5. Ignoring routine health screenings. In our busy lives, it can sometimes be easy to postpone or overlook routine health screenings. Yet, these appointments are truly vital tools for preventative care, especially for seniors. When it comes to kidney health and creatinine levels, regular checkups provide an invaluable opportunity for the early detection of potential problems, often well before any noticeable symptoms arise. You know, kidney disease, particularly in its early stages, is often called a silent killer. Shane. That's because it can progress without any overt signs. By the time symptoms like fatigue, swelling, or changes in urination become apparent, significant kidney damage may have already occurred. Routine blood tests, which typically include a creatinine measurement, are a simple and effective way to monitor kidney function over time. These screenings allow doctors to calculate the estimated glomerular filtration rate, or eGFR, which is actually a more accurate indicator of kidney function than creatinine alone. Tracking eGFR and creatinine levels from year to year enables healthcare providers to spot any trends. A gradual increase in creatinine or a decrease in eGFR can be an early warning sign that kidney function is declining. This early detection is so crucial because it allows for timely interventions that can slow down or even halt the progression of kidney disease. For instance, if screenings reveal slightly elevated creatinine, a doctor can then investigate potential underlying causes. These could be things like uncontrolled high blood pressure, diabetes, medication side effects, or even urinary tract obstructions. Addressing these root causes promptly can often prevent further kidney damage. Seniors, in particular, benefit immensely from these screenings. This is due to the increased prevalence of conditions like hypertension and diabetes, both of which are major risk factors for kidney disease. Also, age-related physiological changes can make kidneys more vulnerable. So, ignoring these routine checks really means missing the chance to catch kidney issues when they are most manageable. Beyond just blood tests for creatinine, routine screenings often include urine tests to check for albumin, which is a type of protein. The presence of albumin in the urine, known as albuminuria, can be an even earlier indicator of kidney damage than an elevated creatinine level. Regular blood pressure checks are also a standard part of these visits, and keeping blood pressure well controlled is absolutely essential for protecting kidney health. Therefore, making and keeping appointments for routine health screenings should really be a priority. These visits aren't just for when you feel unwell. They are a proactive measure to maintain long-term health and well-being. By diligently attending these checkups, Seniors empower themselves and their healthcare providers with the information needed to safeguard their kidney function, keeping creatinine levels in check and promoting healthier aging. It's truly an investment in your future health that can pay significant dividends in your quality of life. Beyond the daily habits we've already discussed, several other factors can influence creatinine levels in seniors. For instance, muscle mass plays a significant role. Since creatinine is a byproduct of muscle metabolism, individuals with greater muscle mass, typically men or very athletic individuals, may naturally have slightly higher baseline creatinine levels. Conversely, seniors who have experienced age-related muscle loss, a condition called sarcopenia, might show lower creatinine levels. This could potentially mask underlying kidney dysfunction if it's not interpreted carefully alongside their eGFR. Certain acute illnesses, such as severe infections or conditions causing muscle breakdown like rhabdomyolysis, can temporarily elevate creatinine. Dehydration from any cause, including a fever or gastrointestinal illness, will also concentrate the blood and, as a result, raise creatinine. Furthermore, it's worth noting that some dietary supplements, particularly creatine monohydrate, which is sometimes used by athletes to enhance performance, can increase creatinine levels in the blood and urine. This doesn't necessarily indicate kidney damage, but it's crucial for seniors to inform their doctors about any and all supplements they are taking. Lastly, race can be a factor in how creatinine equations are interpreted, though this is an area of ongoing refinement in medical practice to ensure an equitable assessment of kidney function for all individuals. Understanding the factors that influence creatinine is truly key to protecting kidney health, especially in the senior years. By being mindful of hydration, medication use, protein intake, blood sugar control, and the importance of routine screenings, seniors can proactively manage these crucial aspects of their well-being and support their kidneys for a healthier future. Found this information helpful? We encourage you to consider sharing this article with others who might benefit. And if you have any questions or experiences to share about managing creatinine levels, please do leave a comment below. We'd genuinely love to hear from you.